Hi, my name is Abby. My number is 46, and I'm going to be doing the musculoskeletal assessment today. Okay, so first I'm going to come in the room and I'm going to wash my hands. Hi, my name is Abby. I'm going to be your nurse today. Can I go ahead and have you confirm your name and date of birth for me?
Joanna Carroll, 4773.
Okay, great. So today we're going to be doing a musculoskeletal assessment. Before I get started with my assessment, can I go ahead and offer you a drink to make you a little bit more comfortable?
Yes, please.
Okay. So go ahead and lay that there. Okay, so like I said, today we're going to be doing the musculoskeletal focused assessment. If you have any questions along the way, just go ahead and stop me and let me know. Before we get started, do you have any questions?
I do not.
Okay, great. I also just want to ensure that everything that we do here today will be kept confidential between me, you, and your healthcare team. So I am going to go ahead and get started. So first I'm going to just be taking a general look at your cervical spine. I'm going to push your hair out of the way here. I note no abnormal curvature of the spine. I don't see any abnormal masses or nodules that would be concerning to me. I'm going to go ahead and just lightly palpate, and I want you to let me know if you feel any pain or tenderness while I do this, okay? Any pain or tenderness?
No.
Okay, great. So now I'm going to go ahead and move on to the range of motion in your neck. So the first thing I'm going to have you do for me is put your chin to your chest. Great, and then go ahead and do it a couple more times. All right, do you have any pain or tenderness while you do that?
No.
Okay, so now I'll have you go ahead and look left to right. Great, and then now I'll have you look up. Okay, and then that's going to hyperextend the neck. So when you're facing me, you're in extension. When you're chin to your chest, you're in flexion. And then whenever you're looking up like that, you're in hyperextension. Okay, so now I'm going to go ahead and move on to the temporal mandibular joint. So what I'm going to do first is I'm just going to note that I don't see any abnormal swelling or any masses or nodules that would be concerning. I'm going to go ahead and now just lightly palpate here. I'm going to have you go ahead and open and close your mouth for me. And I don't feel or hear any abnormal clicking or crepiness, so that's great. Do you ever have any pain or tenderness when you're chewing or opening your mouth?
I do not.
Okay, great. So now I'm going to have you go ahead and just open and close your mouth for me. Okay, and now I'm going to have you try and push your jaw to left to right. Great, and then now I'm going to have you protrude your chin out towards me, and then pull your chin back for retraction. Great, go ahead and do that 2 more times. Protrude, and then retract, and then protrude, and then retract. Okay, great. Any pain or tenderness as you did that?
No.
Okay, so the range of motion in your jaw looks great. Now I'm going to go ahead and assess your supraclavicular joint here. I'm going to go ahead and just note that the skin on the chest looks to be pink to pale. I don't know any abnormal swelling or any masses or nodules. I'm going to go ahead and lightly palpate, and then again, I just want you to tell me if you have any pain or tenderness as I palpate there.
I do not.
Okay, great. So that all looks great so far. So now that I'm done with that, I'm going to go ahead and move into your upper extremities. So first, I'm just going to be lightly palpating and getting a good inspection of the arms. The color of your arms are pink to pale. I don't notice any abnormal swelling, masses, or nodules. So now I'm just going to go in and lightly palpate, and then just let me know if you have any pain or tenderness anywhere.
I do not.
No pain or tenderness?
No.
Okay, great. So with that, we're going to move into the range of motion of your shoulders. I'm going to go ahead and start on this side. I'm going to have you go ahead and hang your arms. Actually, if you don't mind, why don't we go ahead and have you stand up? It might be a little easier for this one. So with this, I'm going to have you go ahead and your shoulder is currently in extension. If I have you go ahead and bring your arm up, you're in flexion. And then go ahead and push your arms behind you like this for hyperextension. Great. Now I'm going to have you go ahead and put your arms out at your sides like this. Okay, and now I'm going to have you go ahead and cross them over. Perfect. So that's adduction and then abduction here. Okay, now I'm going to have you go ahead and internally rotate your arm. And then go ahead and put them behind your back for external rotation. Great. So now we're going to do each of those movements, but I'm going to add some resistance this time. So I'm going to try and lift your arm up, just resist against mine and keep it down, okay? And then I'm going to have you put them over your head. And I'm gonna try and pull down at your arms and just don't let me. Then I'll have you go back to extension on this one. Oh, I'm sorry, just at your side. And then I'm gonna try and pull it up, just don't let me. And then I'll have you go ahead and hyperextend, and I'm gonna try and pull them forward, don't let me. Okay, and then now I'm gonna have you go ahead and put them out at your side. I'm gonna try and push them down, don't let me. And then go ahead and cross them, and I'm gonna try and pull them apart, don't let me. Okay, and now I'm gonna have you internally rotate them. I'm gonna try and push them down, don't let me. And then externally rotate them. I'll go behind you for this one. I'm gonna try and push them down, don't let me. Okay, great. I'll have you go ahead and take a seat again, and then I can put this drape on you again. There you are. Okay. There we go. So now I'm gonna be testing the range of motion at your elbow joint. So I'm gonna first have you just go ahead and put your elbows at your side. And now they are in extension, and then I'm going to have you pull them up like you're doing a biceps curl, and then that is flexion. Now I'm going to have you go ahead and put your arms at your side at a 90-degree angle like this, and then I'm going to have you roll them over and then face your palms down. Great. So now we're going to do each of those again with some resistance. So go ahead and put them at your sides in extension. I'm going to try and pull them up, don't let me, and then go ahead and flex them, and I'm going to try and pull them down, don't let me. Okay, and then go ahead and supinate your hands again. I'm going to try and turn them over, don't let me. And then go ahead and, yep, perfect. And then I'm going to try and push them over, don't let me. Great. So now I'm going to move on to your wrists. You can go ahead and put your arms down. So first, when your hands are flat like that, you're going to be in extension. Can you go ahead and show me your extension? And then go ahead and flex your wrist down like that. So now you're in flexion. Now I'm going to have you put them up towards the sky, and that's hyperextension. Great. Now we're going to do each of those with some resistance. I'm going to pull down, don't let me, and then go ahead and flex. I'm going to try and pull up, don't let me, and then just extend, and I'm going to pull up, don't let me. Great. Okay, now the other two movements that your wrist can do are internal and external rotation. So I'm going to have you internally rotate your wrist, just at the wrist. You don't need to move your elbow if you don't want to. And then I'm going to have you externally rotate. Perfect. Then we're just going to do both of those against resistance. So go ahead and internally rotate. I'm going to try and pull them apart, don't let me. And then go ahead and externally rotate. And just don't let me push them in. Great. So now we'll go ahead and move into your fingers, and then we'll be all done with the upper extremities. So go ahead and lay your fingers out flat so your fingers are in extension. Now I'm going to have you bring them in so that they are flexed. Now you're in flexion. And then you can go ahead and hyperextend your fingers. There you go. And then go ahead and spread your fingers out. And now you are in adduction. And then I'm going to have you push your fingers together. And now you're abducting your fingers. We're going to do each of those with resistance now. So go ahead and put your fingers out as normal. I'm going to try and push them down. Just don't let me. And then go ahead and put your fingers in flexion. I'm going to try them, pull them out. Just don't let me. And then go ahead, put them in hyperextension. I'm going to push them down. Don't let me. And then go ahead and spread them out again. I'm going to try and push them together. Don't let me. Great. And then go ahead and put them together. I'm going to try and pull them apart. Don't let me. Great. So your range of motion looks great in your upper extremities. I would say that you have active range of motion in your shoulders, elbows, wrists, and fingers. I would say that you have a 5 out of 5 muscle strength in your shoulders, elbows, wrists, and fingers. So now that we're all done with your upper extremity, we're going to go ahead and move into your lower extremity exam. So I'll have you go ahead and lie down for me in the supine position. I'm going to go ahead and just push the drape up a little bit here. And then I'm going to just get a general look at your lower extremities. So I know that the color is pink to pale. I don't notice any abnormal swelling or masses or nodules that would be concerning. So now we're going to go ahead and move, I'm going to just palpate down the extremity, and you just let me know if you have any pain or tenderness, okay?
I do not.
Great. Okay, so now we're going to move into your hip range of motion. So the first thing I'm going to have you do is we're going to start with your left hip. And what I'm going to have you do is I'm going to have you lift your leg and then bend at the knee. And so now the hip is in flexion. When you're flat like that, you're in extension. So go ahead and bend and flexion. Oh, sorry, you can just keep it there. And then go ahead and externally rotate. And then go ahead and internally rotate. Okay, and then now I'm gonna have you go ahead and make a straight leg and push it out towards me. That's adduction. Then I'm gonna have you cross over, and that's abduction. So we're gonna do each of those now with some resistance. So I'm gonna try and pull your leg up, don't let me. And then go ahead and go back into flexion. I'm gonna try and push it down, don't let me. And then go ahead and externally rotate. I'm gonna push it in, don't let me. And then internally rotate. I'm gonna push it out, don't let me. Great. So now I'm going to have you go ahead and lie on your left side, or I'm sorry, your right side. I'm gonna have you push your, make a straight leg, and then push your leg back towards me for hyperextension. And now I'm gonna try and pull it back. I don't want you to let me, okay? Great, okay. So now I'm gonna have you go ahead and lie flat again. I'm gonna go ahead and just come on this side now, and we're gonna do the same hip motions that we did with that other side. So what I'm gonna have you do is go ahead and make that 90-degree angle with this foot. Okay, great, I'm sorry, with that leg. So now you're in flexion. Before you were in extension, when the leg is just flat. I'm gonna have you externally rotate that hip, and then go ahead and internally rotate that hip. Okay, great, now we're gonna do it with some resistance. I'm gonna pull up at the leg, just don't let me. And then now I'm gonna have you flex again, and I'm gonna try, I'll actually come around for this. I'm gonna try and push down, just don't let me. Now go ahead and externally rotate. I'm gonna push in, don't let me. And then internally rotate, I'm gonna push out, don't let me. Great. So now I'm gonna have you lie on your left side towards me. And then I'm gonna have you hyperextend that leg back. Now I'm gonna try and pull it forward, just don't let me. Great. Okay, so your hip range of motion looks great. You can go ahead and lie flat again. So now I'm gonna do what's called a straight leg test in both of your legs while I have you lying supine like this. It's easiest to do. So all I'm gonna have you do is I'm just gonna lift at your leg, and then I'm gonna dorsiflex the toes. Do you have any pain when I do that?
I do not.
Great, you can go ahead and put that foot down. Now I'm just gonna go again here. Do you have any pain when I do that on that side?
I do not.
Okay, great. So I'm gonna go ahead and wash my hands since I've touched your feet. Great, so now we're gonna move into the range of motion of your knees. So what I'm gonna have you do is just go ahead and bring that knee up into a 90-degree angle again. So now you're in flexion. When it's straight and flat, you're in extension. I'm gonna have you go ahead and bring it up, and then I'm gonna try and push it down, just don't let me. I'm gonna go ahead and go into extension. I'm gonna try and bend at the knee and pull it up, don't let me. Great. So now we'll move over to this side. Right now your knee is in extension. I'm gonna have you bring it up again into that 90-degree angle, and now you're in flexion. I'm gonna come back over, and I'm gonna try and push this down, just don't let me. And then go ahead and go into extension, and don't let me pull this up. Perfect. So your range of motion against resistance in both of those knees is looking great. So now I'm going to do a couple of special tests that we do that checks for fluid in the knee. So the first one is going to be, I'm going to do the bulge test. So what I'm going to do is I'm going to stroke at the knee 3 to 4 times, and then I'm just going to feel for a bulge. And I don't feel one in this left knee. So I'm going to do that again on the right side. And I don't feel a bulge, so that's great. That would, if we did feel a bulge, that would indicate that you might have some excess fluid in that knee. So the next one is called the ballottement test. What I'm going to do is I'm going to milk just above the knee. And then I'm going to feel, and I don't feel any excess fluid in there. And then I'm also going to feel at the patella, and I don't notice any abnormalities of the patella, like any clicking or popping. I'm going to go ahead and just do that again on the same side. So I'm going to milk over here, right above the knee. And then I'm going to just feel around, and I don't feel any excess fluid. And then that patella feels great. I don't feel any excess or any abnormal clicking or popping in there. So that's all great. The last test I'm going to do in the knee is the McMurray test. So this is a test that assesses for a meniscal tear. And so what I'm going to do with this one, is I'm going to have you flex at the knee, bring it up just like that. I'm going to slightly externally rotate, and then I'm going to internally rotate your foot. As I straighten your leg, let me know if you have any pain. Any pain?
I do not.
Okay, great. Let's do it again on the other side here. So I'm going to have you flex at the knee. I'm going to externally rotate your hip, and then I'm going to internally rotate your foot. And as I straighten, just tell me if you have any pain.
I do not.
Great. Okay, so that would be indicative of a meniscal tear if you were to have some pain when I did that test. Okay, so since I touched those feet, I'm just going to go ahead and wash my hands again. But I guess I didn't really need to because I'm moving back down to your feet. So we're going to go ahead and now test the range of motion in your wrists. For that, I'm going to have you go ahead and slide over and sit down again. So when your ankles are flat like that, they are in extension. And then I'm going to have you go ahead and, I'm sorry, I didn't mean to say extension. I just want you to go ahead and put a gas pedal down with your feet, like you're, like you're on a gas pedal, and that's plantar flexion. Then I'm going to have you point your toes up to the sky, and that is dorsiflexion. So next, I'm going to have you invert your ankles inwards, and that's abduction, and then go ahead and point your ankles outwards for adduction. Great. Now for this one, I'm going to have you internally rotate your ankles so that you're in inversion. So what I want is for your ankles to roll and your toes to be pointed up. Perfect. And then go ahead and roll your ankles out. And then that is for, great. Okay. Just point those pinkies up to the sky a little bit more. Yep. And then on the other side, great. And that's eversion of the ankle. So now we are going to be doing some, I'm going to do those against resistance actually. So go ahead and plantar flex. So put your toes down. I'm going to try and lift them up, don't let me. And then go ahead and dorsiflex. I'm going to push them down, don't let me. Great. And then go ahead and, I'm going to try and push them in, don't let me. And then go ahead and put them in, and I'm going to push them out, don't let me. Okay. And then for that last one, just roll the ankles so that your toes are up. So just roll your ankle over. And I'm going to try and push them down, don't let me. And then do the other side so that your pinkies are up. And push them down, don't let me. Okay, great. So now I'm going to be doing the range of motion in your toes. So for this one, I'm going to have you go ahead, your toes are in extension right now. If you go ahead and point your toes down, that is flexion. Okay, great. So now I'm going to have you just go back to extension, and I'm going to try and pull those toes, can you go ahead and scoot back a little bit? There you go. I'm going to try and put your toes up, just don't let me, okay? Just don't let me put them up. Okay, and then now go ahead and flex your toes. I'm going to push them up, don't let me. Okay, great. So I'm going to wash my hands again. Okay, so now we have completed the range of motion exercises for your lower extremities. So now I am going to say that you have active range of motion in your hips, knees, ankles, and toes. And you also have 5 out of 5 strength in your hips, knees, ankles, and toes. So that's great. Okay, so for this last piece of our exam, I'm going to be examining your thoracic and lumbar spine. So I'm going to have you go ahead and stand up, and I'll remove the drape for you. Okay, so I'm going to have you go ahead and face this direction, and I'm just going to get a general look at your thoracic and lumbar spine. So I don't know any abnormal curvatures, masses, or nodules. The skin looks intact, and I don't notice any swelling or abnormal skin textures or anything. So next, I'm going to have you go ahead and bend at the hip so that you're pointing towards the ground. And I don't notice any abnormal curvatures that might be indicative of scoliosis, so that's great. So now we're going to do some range of motion exercises for your thoracic and lumbar spine. So right now you're in extension with standing up straight. If you bend at the hip again so that you're pointing down, you're going to be in flexion. And then I'll have you come back up towards me and then bend back for hyperextension. Okay, great. Next, I'm just going to have you kind of waddle like a penguin so that you're left to right. Great. Do you have any pain with that at all?
No, I do not.
Okay, great. And then this last one, I'm just going to have you go ahead and I'm going to stabilize your hips. And I just want you to turn to left and right, but try not to move your lower extremities. Just turn the top half of your body. Yep, perfect. Great. Okay, that's great. So now the final piece of the assessment is I'm gonna assess your gait. So I'm gonna have you step back here for me, and I'm just gonna have you walk as normal to the closet. You can just stop at the end of the bed if you'd like. Yep, right there, and then I'll have you turn back towards me. Great, so her posture is erect. You're balancing weight accordingly, appropriately. Your arms were swaying in opposition, and your gait looked steady. You didn't look off balance at all, so that's great. And then that completes our musculoskeletal assessment. So you can go ahead and I'll give you some privacy so you can get redressed, and then I will be back out to get you.
Thank you.
Yeah, thank you.